very good afternoon to you. Welcome to National Heart Week World Heart Day 2020 virtual event. I'm Paige and I'll be your host for today. And we're going to have a cardiologist talk on women's heart health, as we are aware that cardiovascular disease is the leading cause of death in women worldwide. And today we have Dr. Goh Ping Ping and Dr. Chan Wan Xian, who are both sitting on the committee for the Go Red for Women campaign. And they are both going to share with us more about the campaign and why we need to raise awareness on cardiovascular disease for women. So today we have Dr. Goh Ping Ping. She is a cardiologist at Mount Elizabeth Hospital. She is the member of the board of directors in the Singapore Heart Foundation and the chairperson and official spokesperson for the Singapore Heart Foundation's Go Red for Women campaign. Beside her, we have Dr. Chan Wan Xian. She is a cardiologist at Gleneagles Hospital, Mount Elizabeth Hospitals, and Parkway East Hospital, Singapore. She is also a committee member of the Singapore Heart Foundation's Go Red for Women campaign. Thank you, ladies, for joining us in today's session. All right, so without further ado, I will go and chat about our very first question of today. To Dr. Goh, can you share with us more about what exactly is Go Red for Women campaign?
Yes. Go Red for Women is an awareness campaign. It was launched by the Singapore Heart Foundation in 2005. And the aim really is to empower women with the knowledge and the resources to prevent heart disease and to improve their heart health.
I see. Because we're aware that in 2020, there's a women's heart health survey conducted by the Singapore Heart Foundation, and there's a lot of findings to reveal that actually only 9% of Singaporean women are aware that cardiovascular disease is the leading cause of death. Indeed. So today we're going to chat more about how we can have tips and how we can learn more about this awareness and survey as well. And to Dr. Chan, why is the campaign targeted at women?
Right. So this is because heart disease and stroke, actually in combination known as cardiovascular diseases, is actually the top killer of women. It's the most common cause of death among women. Yeah? So in Singapore, in 2019, 27.4% of ladies died of cardiovascular diseases. And in one of every 3 deaths, the cause is actually cardiovascular disease. Yeah, and so actually, women is as vulnerable as men in developing cardiovascular diseases, but yet very few women actually know and are aware of it, and doesn't pay attention to it. So I think this is probably because women in our current era, a lot of us have got busy schedule and we play multiple roles. So many of us work and at the same time play a big part in looking after our family members. A lot of us play different roles. We are both mother, we are all mother, wife, daughter, and daughter-in-law at one. Yeah, so in the busy schedule, a lot of ladies actually neglect on their own health. At the same time, I think cancer diseases actually are more commonly diagnosed. So women therefore has a perception that cancer may be actually causing more significant death impact on women's health. But the truth is that actually cardiovascular disease is the most common cause of death among women. So with a campaign like this, I think then we actually help to increase the awareness among women of cardiovascular risk factors so that they are aware what are the risk factors that can cause cardiovascular disease, and at the same time maybe know more about how the signs and symptoms are among ladies when they have heart problems. And hopefully with this, then we can take the first step in our fight against cardiovascular disease and saving more women's lives.
Yes, indeed. As Dr. Chan mentioned about the signs and symptoms, that's how we can recognize them and to prevent them. So, Dr. Goh, what are some of the signs and symptoms of cardiovascular disease in women? And is there any difference in women as compared to men?
Yes. So the common symptoms of heart disease in women, they will include things like breathlessness, like feeling lightheaded or giddy, irregular heartbeat or what we call palpitations, and also like unexplained tiredness or fatigue. So these symptoms they can be very general, very non-specific, sometimes difficult to link to heart problems. So that's why I think we need to raise the awareness of women in this respect. And there is a difference between the kind of symptom that men and women get when they have heart disease. It is more common for men to actually feel it as a chest pain, and especially when they do some physical activity under exertion. So these are what we call typical symptoms of heart disease or angina. But women, they tend not to have such a typical kind of symptom. So their symptoms may tend to be more vague, or they may be like hardly aware of it until they are really quite advanced in the disease. So that's why, besides the awareness of the symptom, also it is important to know what are the risk factors. So at least we can try to prevent it. Yeah.
Yeah, we will touch on the risk factor very shortly, because from here, we are aware that from the survey, 73% and 59% of respondents were aware that chest pain and shortness of breath are the warning symptoms of a heart attack. This is a good sign, a good number for 73 and 59%.
I think it is already an improvement. There's some improvement compared to the past couple of surveys that were done a few years ago. So I think the trend is improving, but there's always more that we can do. Yeah.
That's why we are here to raise more awareness, right, with the campaign. And yes, Dr. Chan, so when we talk about the risks, what are the risks of cardiovascular disease that women should take note of?
Okay, so the traditional cardiovascular risk factors are conditions like high blood pressure, high sugar, diabetes, high cholesterol, physical inactivity, overweight, and smoking. That's the traditional cardiovascular risk factors. But in recent studies we have seen, there are actually emerging risk factors among women. So some of these risk factors are actually unique to or more common in ladies. So for example, if ladies have got diabetes or high blood pressure during pregnancy, if they have some complications during the pregnancy process like preterm delivery, these are actually all risk factors, and they put the women at risk of developing cardiovascular disease later in their life. Yeah. At the same time, in ladies, so for example, breast cancer is a common diagnosis in ladies, and a lot of women, when they have breast cancer, they go through chemotherapy. Now we know that chemotherapy and the risk factors surrounding the disease actually puts women at risk at developing heart and vascular disease later part of their life as well. Other things like women are at higher risk of developing diseases in the immune system. This also puts them at risk of cardiovascular risk diseases later on. So, but the good news is that although there are many cardiovascular risk factors, but many of these cardiovascular risk factors can actually be prevented, controlled, or even treated. So if the awareness of cardiovascular risk diseases and these risk factors are increased among women and their physicians.
Right. So knowing that there's some good news that we can prevent, and we always want to prevent as early as possible for women. So when should women start checking for their heart health?
Right. So like I mentioned, the cardiovascular risk factors, many can be screened. So the more common ones like high blood pressure. So in fact, once women are above or adults are above 18 years old, they should go for periodic checks in their blood pressure. Yeah. For sugar, blood sugar level and cholesterol, this should be checked. Most of the time, we actually advise more than 40 years old, they should get a check on blood sugar and cholesterol. But the truth is that if there is significant risk factors, so the person already has got other conditions like, let's say, blood pressure problem and all that, then these people, or with a background, if they have got cardiovascular disease in the family, then these people should really go for check as early as possible, their blood sugar and cholesterol level.
Right. Yeah. And can you advise how regular should the check be?
Right. So for blood pressure, actually, if the first check, the blood pressure is normal, then you could do that maybe once every 2 years. This is just a rough gauge. But of course, if it's really borderline in the range, let's say about 130, 140, then you probably should get it checked once a year or even more frequent, so that if there is really high blood pressure, then you get picked up early. For things like diabetes and cholesterol, of course, if the first check is normal, is in a good range, then the next one could be every 2 to 3 years. But these are all rough gauge, and they are in accordance to the MOH. So there's actually a MOH screening guidelines for cardiovascular diseases.
Right. And also, more often than not, people visit the doctors and then they get their checks done. But we actually have a survey finding that only 8% of women had a conversation on heart disease related topics with their doctor in the past 12 months. Is it something that we have to be concerned with?
Yeah, definitely. So we really hope through this campaign to be able to increase awareness and get ladies more motivated. Because to be honest, it should come from ourselves. So if we are more aware and more motivated, we should, of course, approach a doctor as early as possible to get our risk checked. So once you know your risk, then at least you can prevent early. And then the other thing is that once you approach a doctor, don't be shy. So always ask a doctor. There are actually many lifestyle habits and lifestyle options that you can go for before you actually get any disease, and then so you can actually go for lifestyle options. For example, so find out from the doctors first, and then go early for a screen. If there's cardiovascular risk factors, then you need to get it treated, because the earlier you get it treated, then the lower the chance you can get heart disease. And if, of course, unfortunately there's heart disease, then the earlier you get diagnosed, then the chances of survival and survival will be much better and complication will be much less.
Right. So don't be afraid, just speak to the doctor, find out more and get to understand, because it's for yourself, isn't it? Everything is for you yourself. Right. So Dr. Chan, are there any different priorities for women's health in different stages of their life? Say, for example, before 45, after 45 years old, or even 55 years old. Any tips on how to make positive changes towards a more heart-healthy lifestyle?
So honestly, I think with regards to prevention of cardiovascular disease, it shouldn't be tiered according to age. So of course, as I mentioned, I think there's a saying that we always say, prevention is always better than cure. So once there's a chance, the prevention should start as early as possible. Yeah, so like I mentioned earlier, to elaborate a little bit, prevention can come from different parts of our habits in our lifestyle. So adopt a heart-healthy lifestyle. So for example, in our diet, in our daily diet, we could actually play a part on our own and start having a healthy diet. So a rough gauge would be, let's say, a diet plate. So so a diet plate, half the plate, every meal should be vegetables, and then a quarter starchy carbohydrates food, and then the other 1/4 then protein. So, and start to choose in terms of diet choices. So be a bit aware, cut down on food that's high in terms of fats, fried oily food. Then cut down on food that's high in sodium, and try and increase the amount of vegetables and fruits in our diet. And then other aspect, of course, exercise. Exercise is always something that we advocate, and because a lot of research studies actually shows that if you do adopt exercise in a lifestyle. So for example, now actually in quite a few international guidelines, exercise has been, and all this lifestyle management that I've put across has been actually advocated in patients with high blood pressure, diabetes, and cholesterol issues. So these patients, before even starting treatment, should they advocate lifestyle changes like I mentioned. And then even if you're on treatment, it should be concurrent. Yeah. So exercise, then we are talking about moderate level of exercise activities, at least 3 to 5 times a week. And of course, if this could be done when you're doing something that you like. Yeah. So for example, some people like to watch drama. Watching drama, you could exercise and do certain exercises. Then of course that will be helpful, like doing a treadmill during that.
Oh,
so that would be helpful.
That's a good tip. That's a good tip.
That would be helpful. And then besides exercise and diet, of course, weight is something to watch out for. So if you could keep a healthy weight, that's one. And if someone is smoking, try as much as possible to stop smoking, because smoking not just put you at risk of cardiovascular diseases, but many other diseases. Yeah.
Right.
And something less usually overlooked is actually stress. So we now know that a lot of mental stress in our life actually puts you at risk of developing cardiovascular diseases. And if you adopt certain techniques to be able to manage your stress, that actually cuts down the risk of cardiovascular diseases.
Wow, thank you very much, Dr. Chan, for sharing so much tips on from diet to exercising, your lifestyle and stress. Indeed, we would like Dr. Goh to expand a bit more about lifestyle changes in terms of the exercise aspect. Any other tips for us to make positive changes?
Yeah, so actually, we have realized that exercise is medicine. So it's a form of treatment for many forms of heart disease, as well as risk factors such as diabetes, like hypertension, high cholesterol, and so on. So aerobic exercise actually is the main bulk of exercise that we would like to advocate, because these are the exercises such as like brisk walking, jump rope, like cross trainer and so forth, stationary bicycle, dancing. I think lately someone has introduced to me Zumba Go, also as a very popular kind of aerobic exercise. So these are generally the exercises that increases the heartbeat. It helps the heart to have a workout and also help the lungs to expand and take in more oxygen, makes the circulation more active. So, and as Dr. Chan mentioned just now, the frequency and the regularity is very important. Yeah, so at least 3 to 5 times a week, 30 minutes or more of aerobic exercises. Yeah.
Right, thank you for sharing. Wow. And because that leads to my another question that we actually realized from the survey, there's actually a physical inactivity which is more prevalent among the older females, aged 50 to 64. Why do you think this is so?
Yeah, I think you're referring to that part of the survey where we find that this subgroup of ladies are really having really much more sedentary than the younger age group. So I think, and these also are the ladies who tend to be a bit more on the overweight side. So, and many of them have actually voiced that they would very much like to have regular exercise if they have company, or if they have, say, for example, support or company from their friends, relatives, and so forth. So I think motivation very important in this group, and also having some kind of regular group commitment, friendship, and so forth to keep it going.
Yes, I think it does help, when you have, someone is coming along with you to work out, or, you're meeting your friend at a Zumba class, things like that. It actually motivates you somehow.
But with safe distancing, of course.
Yes, of course, right now with distance as well. And also to Dr. Goh, what does the Singapore Heart Foundation do to help fight cardiovascular disease in women?
Yeah, Singapore Heart Foundation has done a lot of work. Every year we have the Go Red for Women campaign. And as part of the campaign, we usually have a series of events, including outdoor events, such as walks, and also health talk to the public, supermarket tours, cooking classes, and so forth. Yeah, so I would really very much like to encourage people to take part in it, and also to check our website regularly for any new activities.
Yes, especially for the National Heart Week, World Heart Day in the month of October. So check out the microsite as well. Right. So ladies, any other advice you would like to give to our audience? Anything to add on?
I think the key really is prevention. Yeah. So I think once, hopefully after today, with our sharing, women are aware that we are at risk. Yeah, we are not safe from heart diseases, and we are at risk. So please see your doctor early, at least get a risk profile check. So if you're at risk, then you can do something to prevent it, or unfortunately there's really risk factors, then we can start treatment early. But if not, then no, don't wait. You still should try for heart healthy lifestyle as soon as possible, like the tips I've gone through. Unfortunately, if there's heart disease, then again, you can pick up early if you see a doctor early, and then treatment can start, and then we could help fight heart disease and hopefully cut down the rate of women dying from these conditions. Yeah.
And Dr. Goh?
Yes,
Anything to
and
add on?
I think, don't be shy. Speak to your doctor if you need certain advice. Yeah, and also I think families and friends do encourage your mom, your mother, your wife, etc. To take charge of their heart health. Yeah.
Thank you once again, Dr. Goh and Dr. Chan. More survey findings can be found on the National Heart Week World Heart Day 2020 virtual. Thank you once again. I'm Paige, and we will see you next time.